Vidal, and we are live here on Pure Plastic Surgery on Tuesday Tips. This is our weekly check-in. We go over different topics of plastic surgery, and I get to answer your questions. Thank you so much, everyone, for joining me every week. This week, we're going to talk about a topic that I don't talk a lot, but I do. And I have a lot of patients. I had a facelift today, and a lot of patients were like, "You do facelifts? I want to see before and after, so I want to see your technique." So I'm going to talk a little bit about it, the common questions and the common add-ons, because facial rejuvenation, it is and I like to term it facial rejuvenation, so we don't focus only on the facelift. And I'll go over kind of the differences in between each procedure and what each procedure addresses or fixes, okay? So facelifts are one of the it has been done for many years, but there's been, of course, like every other procedure, improvements in the techniques. So we make it more natural for the results to don't look pulled or tight, which is unnatural and it doesn't look great. So in social media, probably everybody's seeing all the pictures of the celebrities and trying to guess, have they done facelifts? Where are the scars? Was all that about, and why don't they look pulled but they look rejuvenated? And I think that's the most important concept to understand with a facelift. Okay, so a facelift procedure basically removes excess skin and addresses the laxity of the deep tissue of the face. And in social media, it has gone viral about deep plane facelifts. So a lot of patients ask you to do a deep plane facelift. So what is this? The short answer is yes, I do. But what is it? So the deep plane of the face is basically a layer called the SMAS layer. The SMAS layer is basically a combination of the deep fascia of the face, the muscles, and all of that holds the fat. So the deep fat of the cheeks in our bones. With facial aging, we not only see the laxity of the skin, but we also see the scent of the deep tissue. Okay, that SMAS layer has in it all that fat, deep fat. When we're young, that fat is sitting very high up. So our faces have more of a heart shape, a little wider at the top, narrower at the bottom, fuller in the cheeks, less definition or less differentiation between your lower eyelid and your cheek because the cheek is higher. With aging, you see facial drooping, where all of those deep layers start to descend with gravity, motion. Imagine how many times a day you move your facial muscles. You smile, you're eating, you're moving your face. Every time you move, all of that puts some laxity in your deep tissues, okay? And it's not normal to be kind of like not moving all day since you're 20 because that's not realistic, right? But it's just a reality of our faces. We're very animated and we move a lot. So all of that is going to create some laxity in this tissue and also some volume loss in the bone itself. Okay, so with the bony loss, we lose volume not only in the cheeks but also in the jawlines. We get the scent, we see more definition of the lower eyelid, we start to see the jowls, which is the soft tissue that was supposed to be in the neck, starts to drool, and you see it anchored here in the lower part of the face, and of course laxity in the neck. Majority of my patients, the majority, are like, I just want to get rid of this, right? We start to see, we do a lot of selfies, we're in cameras all day, and what we see is the neck. But the reality is, if you just tighten your neck without addressing the lower face drooping, you're gonna look very awkward because this is gonna look tight and you're gonna have a ball hanging here that it doesn't match up, okay? So majority of patients, especially if you're over 40, 45, if you're looking into a neck lift, you're probably gonna need a facelift as well. When we're talking about facelift, I always address the neck, okay? It's kind of a combination. A facelift includes the neck. Okay, so the deep plane, it is important to always address the deep plane. When we're talking about facelifts, we need to address that deep tissue, that SMAS layer. There are different techniques, and this is going to depend on the patient. Have you had a prior facelift? The amount of droopiness. the amount of laxity of the tissues, any surgeries in the face, and that's how we address it. You may need a full dissection, a full deep plane facelift. Is you kind of dissect all of that mask layer and release some of the ligaments that are holding it down, so you can mobilize that tissue and put it where you want it, which is in the upper mid face. You can plicate it, which is kind of folding it in. It's similar to what we do with the tummy tuck, it's kind of folding it in, tightening the tissues without the full mobilization. Depends on on your anatomy. I'm going to evaluate your case and I'm going to let you know what's best for you, what I recommend for you. Or you can do a full dissection only on the higher level and tightening or close that tissue. Bottom line is, whatever you do with this mask, the important thing is you address this mask, okay? If you just tighten the skin and do not reposition the deep tissues of the face, it's gonna look pulled, it's gonna look unnatural, it's gonna look like this, and that doesn't look good, okay? You wanna restore the youthful appearance of the face without looking pulled or tight, okay? So the incisions for a facelift are incisions that can be placed in the creases of the face that they heal very, very naturally. Of course, if you see before and afters that the scar is just in front of the ear like this, that's not going to heal well. The good surgeon goes in the creases of the ear and goes in the folds all around it, so it's very hard to see the scar at first, and the initial healing period is going to be more noticeable while it kind of fades out. But with proper scar treatment, plus minus lasers in the future, it is a scar that hides very, very well, and that is posterior to the ear and in the scalp, okay? There's also one small incision that I do in the neck, in the fold here, that you're gonna see it go like this, but it's that scar that heals very nicely in the natural submental crease. And what do we do to the face? So I talked a little bit about what we do in this mask layer of the face. What do we do with the neck? The neck is a combination of removing the excess fat in the subcutaneous space, so between the skin and the muscle, addressing the muscle or the platysma muscle is important. The platysma muscle is our animation muscle, and that muscle with animation, with movement, with eating, with time gets lax, and that's why you see fullness in your neck. Not only because fat accumulates, but also the platysma gets weak. So you have to address the muscle by tightening that platysma, releasing some of the bands, you don't see those bands, and also addressing the deep neck, so the deeper layer of the platysma sometimes is needed to create a better contour. There may be some fat in that compartment, your glands, your submandibular glands may be a little tautic or droopy, and that creates fullness, and also your muscles of mastication, or called the digastric muscles, may need to be tightened. So all of this is done when we're addressing the neck, okay? So we did this mask, which is a cheek area, we did the neck, everything is tight, everything is great. What about other areas that are commonly addressed in a facial rejuvenation case? For example, my patient today, she had a full face and neck lift, but she also had an upper lip lift. I think this is a great procedure. It is a procedure that you just make an incision in the creases of the nose. It's a scar that hides very well, and it rejuvenates the lip area and the lower face in the front view a lot. With aging, the distance between your nose and your lips elongates. Again, movement, talking, eating, this stretches with time. And what happens? The lips look thinner because everything is so long that the red lip or the juicy part of the lip, now it's on the inside. If you do an upper lip lift, you remove that excess skin and tighten everything up, so you evert or bring out the fullness of the lip. So a lot of patients are looking to have lip fillers to create volume, but if you don't restore that precision and youthful position of the lip, you're just gonna have a fat lip that is hanging, and we don't want that. We want a youthful appearance that brings it up, everts it, and then you have some teeth showing. In the natural resting, we want our lip to be just covering just half of the incisors, not completely. So with aging, this droops and you stop seeing your teeth unless you kind of smile very big. So this is a great procedure to complement with a facelift like I did with my patient today, and it rejuvenates a lot with the face in the frontal view, not only the lateral and the oblique views, okay? Blepharoplasty is the most common upper and lower blepharoplasty or eyelid procedure because a facelift really doesn't address the upper third of the face. We divide the face in 3/3, right? The upper third is the eyes, the eyebrows. We have the mid face and we have the lower face with the neck, right? Those are 3/3 of the face. With a facelift, face and neck, we address the second and the third, but not the first third of the face, which is the eyebrows and eyelid area. So this is a great procedure to rejuvenate that area. It is a combination of skin removal, sometimes muscle removal, and fat when it's bulging. Those little bags that you see, that's a combination of excess skin and also excess fat that bulges out. It is also a great procedure to do on itself. This is a procedure that it's very well tolerated, it's not very painful, and the recovery is shorter. In facelift, you need a little bit more time off because of the swelling that's going to be generalized in your face. But the blepharoplasty, you can go back to work in a week or two. With makeup, you can hide it, and it rejuvenates a lot, just the upper face. It gives you a refreshed look in a procedure that's very well tolerated and shorter. Brow lift is always important to address. We always look at the excess skin in the eyelid, but if your brow it starts to get lower with age, you're gonna see that fullness in the upper eyelid, and it's really not because of excess skin of the eyelid. It can be a little bit of excess skin, but also exacerbated or make it worse because of the brow ptosis or droopiness. So a brow lift also rejuvenates the upper third of the face a lot. We can do a brow lift blepharoplasty with a facelift and kind of do a full facial rejuvenation. And the other thing that I think is super important is addressing the volume. Like I mentioned, with aging, it's not only the sagging of the skin, the droopiness of the mask layer and the platysma and neck structures, but it's also loss of volume. We lose volume in the fatty layers, but we also lose bone volume. So fat grafting is a great combination to restore some of the volume that you lost with aging, and also complementing it with removing that excess skin and tightening everything on the deep layers so you have a full facial rejuvenation. This I didn't include, but I think lasers and also resurfacing of the skin is great. And of course, if you're gonna go through all of this, you need to invest in a good medical grade skincare, okay? Not gonna go through all of this and don't take care of the area that's most important visually, which is your skin, okay? So always keep that in mind, that's very, very important. The common question before we jump to your questions that I get, if I do a facelift, I don't have to do Botox anymore. The reality is no, you still need to touch up your Botox because the muscles of the forehead and around your eyes are still intact, okay? So you're gonna be all rejuvenated, but with movement of the forehead, you're still gonna see those wrinkles that we don't want to see, okay? Questions?
How long does a facelift recovery last?
Very good questions. There are basically 2 stages or 2 forms of recovery. The one that you're gonna feel good and the one that you're gonna look good, okay? So let's talk about the one that you're gonna feel good. You're gonna feel basically good, not much pain in 2 to 3 days, really. This is a surgery that's not very painful. People are like, oh my God, you're gonna open my face, I'm gonna be in so much pain. This is a skin and soft tissue surgery. We're not gonna do structures that are like more painful, like the abdominal muscles that restrain your ability to stand straight. Lipo tends to cause more pain than this, actually. The most uncomfortable part is the swelling. You get very swollen, like any facial, like if you've done fillers, you get very swollen. But imagine we're doing the face entirely, so it does get you swollen, but you're gonna feel basically normal, not much pain in 2 to 3 days, but you're not gonna look good in 2 to 3 days. Patients usually take about 3 weeks to be able to start going out, like to dinner and events, without noticing or people noticing that you had something done. You're still gonna be swollen, but you can hide it with makeup, you can put your hair down, and people usually start to go back to work at 2 to 3 weeks because you can hide it with makeup. When are you gonna be red carpet ready, wedding ready, big event? At least 3 months, okay? There's still gonna be some swelling that if you wanna put your hair back or you wanna do like a big event, lights, cameras, it's better to wait at least 3 months to have all that swelling come down so you're perfect for that.
Are you able to do everything you stated together?
Yes, it is possible. It is long surgery, so we do have to schedule it ahead of time. So I block one surgical day for my face procedures because I go all in for today. That was my only case. I go to my facelift procedures having my schedule clear and focusing 100% on you. We're good? Okay, awesome. Thank you so much, you guys, for joining. I think one of the most important things to remember about this is that the surgery needs to be maintained long term, so you don't lose. Like, how long does a facelift last? It really, I mean, it's permanent in the sense that it's not gonna get undone in a few years, but you're gonna continue to age, right? So if you don't continue to prioritize on your hydration, on your skincare, on a good nutrition, working out, weights, all of this is going to contribute to you have a healthy skin, healthy life, and that's going to reflect on your face. So majority of patients say that 10, 15 years, they see some aging changes that they want to correct. But I have patients that, 20 years later, they're still happy with their facelift results. So it is much of a personal decision depending on how aging progresses thereafter, okay? So see you guys next week on Tuesday Tips. Have a beautiful week. Enjoy your Memorial Day weekend.